Good morning, students. Here we come up with ligaments of the shoulder joint. Now, in the ligaments of the shoulder joint, we have already discussed fibrous capsule, that is capsular ligament and synovial membrane. Now, after capsular ligament and synovial membrane, we come up with, this is the next ligament. This will be the glenohumeral ligament. The glenohumeral ligaments. Then we come up with the glenoidal labrum, another ligament, glenoidal labrum. Then we come up with the next ligament, that will be coracohumeral ligament, coracohumeral ligament. And then we come up with the last ligament, that is transverse humeral ligament, transverse humeral ligament. So these are the four ligaments which we are going to discuss today after the discussion of capsular ligament and synovial membrane. Now, after discussion of these ligaments, we are going to discuss a very important aspect, although it is not a ligament of shoulder joint, but this needs to be mentioned here, and that will be coracoacromial arch. That needs to be discussed here, coracoacromial arch. And finally, in the end, we have to discuss the factors which produce stability to the shoulder joint. So the factors which provide stability to the shoulder joint. So these are the points which we are going to discuss, and all the points will be discussed based on only one diagram, line diagram. So first, let us try and draw this line diagram. Here, this is the greater tubercle, this is intertubercular sulcus, this is the lesser tubercle, and this will be the head. Why I put dotted line is because it is going to be covered by fibrous capsule. So here, this is how we draw the greater tubercle, lesser tubercle. Of course, this will be the head of the humerus. And here we are going to show, this is the glenoidal margin, glenoid cavity, cross section. Now above that we are going to show, this is what you need to draw, coracoid process. This is the coracoid process. Coracoid process. This coracoid process, you can just shorten it, and therefore this will suffice as the coracoid process. And over here, you can join this margin. Now above the coracoid process, we are going to draw acromion process. So this will lead to acromion process. So this is the basic line diagram. Now on this line diagram, we are going to cover it with the ligaments. So the first ligament, if you come over this side, glenohumeral ligaments. Now there are three bands of glenohumeral ligaments: superior, middle, inferior. All the three bands of glenohumeral ligament, they are thickenings of anterior wall of fibrous capsule of shoulder joint. So they are just the thickenings of anterior wall of fibrous capsule of shoulder joint. With yellow color, we will show the fibrous capsule. So if this is the fibrous capsule, this entire structure is the fibrous capsule. And if we provide a light yellow color, this is the light yellow color, where we show that it is the fibrous capsule covering the entire shoulder joint. So therefore, this is the fibrous capsule which is covering shoulder joint. And fibrous capsule we have discussed in the previous segment, that is the capsular ligament. Fibrous capsule is the capsular ligament which covers the shoulder joint, that already we have discussed. Glenohumeral ligaments, they are three bands, superior, middle, inferior. They are the thickenings of anterior wall of fibrous capsule, thickenings of anterior wall of capsular ligament of shoulder joint. So this is the anterior wall, this is the fibrous capsule, and therefore the anterior wall of fibrous capsule or capsule ligament will show three bands, three thickenings which are called glenohumeral ligaments. Now second point. These glenohumeral ligaments will be passing upwards and medially. They will pass upwards medially and will be attached to the superior-medial margin of glenoid cavity. So that is the superior-medial margin of glenoid cavity. They are attached here. That means they are attached above to the superior-medial margin of glenoid cavity, and they will be attached to the glenoidal labrum. Glenoidal labrum is attached here, that we are going to discuss. So the three bands, as they pass superiorly medially, they are attached to the superior-medial boundary of the glenoid cavity, where they are attached to the glenoidal labrum. Third point, these three bands, lower part, they are attached in such a way that we need to show this lesser tubercle. So for that we are going to darken the lesser tubercle. This is the margin of lesser tubercle which we are going to darken, and this is the margin of greater tubercle. And here this is intertubercular sulcus. So the three bands are attached in such a way around the lesser tubercle that here we go, the superior band of glenohumeral ligament. Now we are going to use green color. The superior band of glenohumeral ligament will be attached to upper border of lesser tubercle. It is attached to the upper border of lesser tubercle, so it will be attached in this way. This is where the superior band is attached. Here I am drawing the superior band of glenohumeral ligament. Middle band of glenohumeral ligament will be attached to the lower border of lesser tubercle. This is where I will draw the middle band. The middle band is attached to the lower part of lesser tubercle. Now, inferior band. The inferior band will be attached to the anatomical neck. Here this will suffice as the anatomical neck. Therefore, the inferior band of glenohumeral ligament will be attached to the anatomical neck of the humerus. These are the three bands of glenohumeral ligament. So this is the fourth point. And we are going to mark first, this is superior band. Second, this is the middle band. Superior band is attached to upper part of lesser tubercle, middle band is attached to lower part of lesser tubercle, and this will be the inferior band. And this inferior band is attached to the anatomical neck, lower down. Therefore, altogether, these three glenohumeral ligaments, they are the thickenings of anterior wall of fibrous capsule of shoulder joint. They are directed upwards medially. They are directed upwards medially attached to the superior medial wall of the glenoid cavity, and they are attached to the glenoidal labrum. And finally, the lower attachments will be superior band is attached to upper part of lesser tubercle, middle is attached to the lower part of lesser tubercle, and inferior will be attached to the anatomical neck. This will be the three glenohumeral ligaments. Then we come across to glenoidal labrum. We come across to glenoidal labrum. The glenoidal labrum will be fibrocartilaginous rim which is attached to the margin of glenoid cavity. So the glenoidal labrum will be fibrocartilaginous rim which will be attached to the margin of glenoid cavity, here orange color, and therefore this will be the fibrocartilaginous rim which I am showing with orange color. This is the glenoidal labrum. And this glenoidal labrum will surround the glenoid cavity on its peripheral margin, except at superior position, except at the superior level where it will have a small passage for the long head of biceps brachii muscle. So that is glenoidal labrum. And of course all these three bands, glenohumeral bands, they are attached to the glenoidal labrum. And therefore we are going to mark here the glenoidal labrum. So this ligament as of today, second ligament is over, glenohumeral ligaments, glenoidal labrum. Now we consider coracohumeral ligament. Coracohumeral ligament will be the ligament which is attached to the lateral border of coracoid process. So lateral border of coracoid process, it will be attached, So you show it, lateral border of coracoid process, and this ligament will pass downwards and it will be attached where? It will be attached at the upper part of the intertubercular sulcus. So it will be attached to the anatomical neck where in the upper part of intertubercular sulcus. So therefore, this is the coracohumeral ligament. Here we show the coracohumeral ligament which is attached here in the upper part of intertubercular sulcus. So this coracohumeral ligament extending from the lateral border of coracoid process till the upper part of anatomical neck in the region of upper part of intertubercular sulcus, that is coracohumeral ligament. And this coracohumeral ligament, once again, one important point will be, it is the thickening of superior part of the capsule of the shoulder joint. So this coracohumeral ligament is also the thickening, but in the thickening of the upper part of the fibrous capsule. Same as glenohumeral ligaments, which were the thickenings in the anterior wall of fibrous capsule. Coracohumeral ligament is the thickening of the fibrous capsule in its superior wall, in upper wall. Please mark this point. So here we finish our coracohumeral ligament. Then we come across to transverse humeral ligament. That is the last ligament. Transverse humeral ligament will be, it is functioning as a retinaculum and it will bridge the intertubercular sulcus in its upper part. That means it will connect both the walls of intertubercular sulcus, medial and lateral lips of the intertubercular sulcus, and it will cover the upper part. And here I am going to show with the red color. If I show with red color the transverse humeral ligament, this is how the transverse humeral ligament will be covering the upper part of the intertubercular sulcus. So it will function as a retinaculum to hold with structure. It will function as retinaculum to hold the long head of biceps brachii muscle, to keep the long head of biceps brachii muscle which is passing beneath it in its proper position. So this is the transverse humeral ligament. Here, this is the transverse humeral ligament, and that is ligament number 4. The glenohumeral ligaments, then glenoidal labrum, then the coracohumeral ligament and transverse humeral ligament. Now, as I told you, we finished the ligaments previously, including the fibrous capsule, that is capsular ligament and synovial membrane. Now, this is the coracoacromial arch, which needs to be mentioned here. What is coracoacromial arch? Which you have to write 2 or 3 points about it. Coracoacromial arch is the arch which is formed by 3 structures. First structure will be acromion process of the scapula. Second will be the coracoid process of scapula, and the third structure is the ligament which is extending between the tip of the acromion process and lateral border of coracoid process, and that is coracoacromial ligament. So here you need to show the coracoacromial ligament. If I show the coracoacromial ligament, this is how the coracoacromial ligament will be present, and this is extending from the tip of acromion process till lateral border of coracoid process. So therefore, here we are going to name this as coracoacromial ligament. And here we are going to term these 3, acromion process, coracoid process and coracoacromial ligament, as coracoacromial arch. Now, what you need to mention in coracoacromial arch will be the attachment of this ligament from the tip of acromion process to the lateral border of coracoid process. Second important point will be, this entire arch will be separated from supraspinatus muscle. That means supraspinatus muscle will be beneath this arch. It will be separated from supraspinatus muscle by subacromial bursa. So there will be presence of subacromial bursa which is present just beneath this arch. Here, this will be the subacromial bursa which is present just beneath the arch. And therefore, now this entire arch, coracoacromial arch and subacromial bursa, it will function as the socket which will help in the overhead abduction of the humerus. During the overhead abduction of the humerus above the shoulder level, there will be lateral rotation of the humerus, and so it will provide for the smooth lateral rotation of the humerus during overhead projection of the shoulder or overhead projection of humerus above the level of shoulder joint. So therefore, this coracoacromial arch here will function, it will function as the secondary socket for the humerus. Then we come across to the last segment, that is the factors which provide stability. The factors which provide stability to the shoulder joint. Now in the factors that provide stability to the shoulder joint, two very important points which is a must you have to mention. And those two important points will be, before we explain the two important points, one sentence you need to mention, that is the shoulder joint, because the fibrous capsule is very lax, there is loose attachment of fibrous capsule, and because the glenoid cavity is very shallow, this shoulder joint has maximum mobility. But because of this maximum mobility, it will also have one property which is known as dislocation. So therefore, because of maximum mobility and because of the laxity of the fibrous capsule and because of the shallow glenoid cavity, this head of humerus or the shoulder joint has the property of dislocation. So it has this tendency of dislocating many a times. And there are various factors which will prevent this dislocation. And what are those factors which will prevent this dislocation? That means they will provide stability to the shoulder joint. They are two very important points. The first important point will be the dislocation of the head of humerus. Either it will be in superior direction or inferior direction. Now the dislocation of head of humerus in the inferior direction will be prevented by, number one, supraspinatus muscle. So here, in this case only, if I just mention, this is the downward dislocation of the head of humerus. It is prevented by which factors? By the attachment of supraspinatus muscle, by the insertion of supraspinatus muscle, where here it is attached in the direction from superiorly. And this supraspinatus muscle, some of the fibers are attached on the superior part of the capsule. So the supraspinatus insertion in the superior part of the capsule, which will prevent the downward dislocation of the head of humerus. And along with that, another factor, along with the supraspinatus insertion in the superior part of the capsule, another factor which will prevent the downward dislocation of the head of humerus will be the presence of coracohumeral ligament. The coracohumeral ligament. So here also you have to mention coracohumeral ligament, which will prevent the downward dislocation of the head of humerus. Many times this is asked as the MCQ, coracohumeral ligament. It will prevent the downward dislocation of the humerus. Now, after this segment, I will draw this upward arrow. This signifies upward dislocation of the head of humerus. Now this upward dislocation of head of humerus, this is the second point. The upward dislocation of head of humerus is prevented by, once again, two very important structures. The first structure will be long head of biceps brachii muscle, the long head of biceps brachii tendon, which will prevent upward dislocation of the humerus. And along with that, there is presence of this coracoacromial arch. So coracoacromial arch will also prevent the upward dislocation of the head of humerus. So these are the two important points in the factors providing stability to the shoulder joint. Now, after these two important points, another two important points which needs to be understood. That is one point which already I have discussed yesterday, that was the musculotendinous rotator cuff. This musculotendinous rotator cuff will provide extra stability to the shoulder joint, and therefore this is provided by subscapularis muscle, then supraspinatus, infraspinatus and teres minor. So this is known as the dynamic stabilizer of the shoulder joint, that is the musculotendinous rotator cuff. This is the musculotendinous rotator cuff of the shoulder joint. And the last important point which you need to mention will be, glenoid cavity is very shallow. The entire glenoid cavity is very shallow. And this glenoid cavity is deepened by, it will be deepened by attachment of glenoidal labrum. So this shallow glenoid cavity is deepened by glenoidal labrum, which will provide extra depth to the head of the humerus. So therefore, this glenoidal labrum will provide extra depth to the head of the humerus in various movements of shoulder joint. So it will provide as one of the factors in stability to the shoulder joint. So these are the ligaments, and here we complete the ligaments of the shoulder joint. Thank you very much.